Hello everyone, welcome to today's episode of Quick Insights into Sickle Cell Disease. In this video, we will look at how sickle cell is treated. Let's get started. Optimal treatment regimens for sickle cell focus on improving hemoglobin levels and managing pain crises. In this video, we will delve into 5 crucial treatment options. First, we will look at pain management, discussing the medications used to handle mild and severe pain crises. Next, we will cover preventive care treatments designed to boost hemoglobin levels and prevent infections. Afterward, we will look at strategies for managing chronic complications, addressing persistent issues that arise with sickle cell. Then we will move on to lifestyle and stress management, where I will share practical tips to help minimize pain crises and manage stress effectively. And finally, we will explore advanced treatments. In this section, I will introduce you to groundbreaking therapies that could potentially cure sickle cell disease. Let's dive into the details of each regimen. Managing sickle cell pain requires a range of medications. In this section, we will focus on 2 key groups of analgesics: NSAIDs and opioids. NSAIDs provide pain relief and help reduce inflammation. Some common examples include aspirin, ibuprofen, and diclofenac. These drugs work by inhibiting the COX enzymes, which are responsible for producing inflammatory mediators. Do you remember the role of inflammatory mediators? Well, I covered that in my previous Quick Insights video. I explained how immune cells trigger inflammatory mediators, which then sensitize nerves around affected tissues, amplifying pain perception. Okay, so now, when a sickle cell patient takes an NSAID during a pain crisis, the drug blocks the production of these inflammatory mediators, preventing nerve cells from becoming sensitized. This reduces inflammation and pain perception, ultimately providing relief for sickle cell patients. NSAIDs are more effective than basic analgesics like paracetamol, especially for managing the inflammation associated with sickle cell crises. Paracetamol is commonly used for mild to moderate pain, but it does not really reduce inflammation, which is why NSAIDs are often preferred in these cases. However, NSAIDs can cause discomfort for some people, like those with stomach ulcers, asthma, pregnant women, and some children. For this group of people with sickle cell, paracetamol is usually given instead because it's more safe. For very severe pain, especially in emergency situations that may require hospitalization, opioid injections are administered. These strong pain relievers, such as tramadol and morphine, provide immediate relief by blocking pain signals in the central nervous system, offering rapid and effective relief for sickle cell patients. Overall, all these pain medications work by blocking pain signals in the central nervous system. However, opioids are the most effective and provide the fastest relief. I do not encourage self-medication because NSAIDs and opioids can have serious side effects if abused. And while opioids are indeed powerful pain relievers and can provide rapid relief, they are not always the most appropriate choice due to their potential for addiction. So it is best for sickle cell patients to always consult with their healthcare providers to safely manage pain crises. Now, let's shift our focus to preventive care regimens. Effective management of sickle cell relies heavily on preventive care. Some key preventive options include folic acid supplementation. Folic acid helps the body produce new red blood cells, which is crucial for sickle cell patients. More healthy red blood cells improve oxygen delivery throughout the body, helping to lower the risk of sickle cell crises. The next preventive option is vaccination and antibiotic use. Preventing infections is important because Infections can trigger inflammatory responses that may lead to sickle cell crises. To reduce this risk, sickle cell patients are often given vaccines and antibiotics to prevent or fight infections. This helps to decrease the likelihood of these inflammatory reactions. Let's delve into managing chronic complications. Managing chronic complications in sickle cell requires targeted interventions like blood transfusions. Blood transfusions are crucial for managing severe anemia and reducing sickle cell crises. By replacing sickled red blood cells with healthy donor cells, transfusions improve oxygen delivery throughout the body. This reduces the risk of serious complications like acute chest syndrome and stroke. This makes transfusions life-saving for some sickle cell patients. Hydroxyurea therapy. This oral medication increases the production of fetal hemoglobin, which is a healthier form of hemoglobin that enhances oxygen delivery and prevents acute vaso-occlusion. By reducing the frequency of painful crises, hydroxyurea also decreases the risk of complications like anemia, stroke, and acute chest syndrome. This therapy also reduces the need for frequent blood transfusions. Some sickle cell patients have a milder form of the condition and may not require blood transfusions. Instead, they may rely solely on preventive regimens and possibly hydroxyurea therapy. Let's take a look at the lifestyle and stress managing tips. Sickle cell patients can enhance their condition by adopting the following lifestyle tips. The first and most important is staying hydrated. Dehydration can lead to low oxygen levels in the blood, contributing to vaso-occlusion and consequently pain crises. When the body is dehydrated, the blood becomes thicker or viscous, making it difficult for red blood cells to flow smoothly through blood vessels. This increased viscosity can cause red blood cells to clump together and restrict blood flow. It is therefore crucial for sickle cell patients to drink plenty of water frequently to stay hydrated and support healthy blood flow. Limiting exposure to extreme weather is also vital. Extremely cold and hot weather can trigger sickle cell crises. How does this occur? Well, cold temperatures can cause blood vessels in the skin and other parts of the body to narrow, restricting blood flow and leading to blockages. So to prevent this, sickle cell patients are advised to dress warmly in cold weather. In extremely hot conditions, dehydration occurs more rapidly, causing a faster loss of oxygen from red blood cells. And so, staying hydrated and avoiding excessive heat is equally essential to prevent these complications. High stress levels can exacerbate symptoms. Therefore, getting enough sleep and engaging in moderate exercise while avoiding strenuous activities can help manage stress effectively. Maintaining a balanced lifestyle and managing stress are crucial for the overall health and well-being of sickle cell patients. That is all for this video. To keep things brief, we have covered only the basics here. For a detailed look at the advanced treatments, check out our next video. Don't forget to subscribe and stay tuned.